Welcome to Learning Plan 10, Issues in Theory and Practice. For this learning plan, you're going to read Chapter 10 in your textbook, go through the PowerPoint, read Chapters 25 through 27 in Lying on the Couch. You'll review key terms for Chapter 10, and you'll watch Why Not Cheat and Assessment Process. You'll post case study responses to the discussion board and also participate in the discussion board Lying on the Couch discussion. Let's talk about issues in theory and practice. This chapter discusses how developing a counseling style relates to ethical practice. You need to understand the ethical issues involved in using techniques. You need to better understand ethical, clinical, and cultural issues in assessment and diagnosis. You should be able to explain the arguments for diagnosis and clarify the arguments against diagnosis. Did you know some counselors don't use the DSM? They don't. Did you know some counselors don't bill insurance because they would have to use the DSM? Some of them really feel it's unethical to have to diagnose, as insurance companies want, within the first time of seeing someone. It is very rare for someone not to use the DSM, and it is very rare for someone not to bill insurance, but it does exist. And we'll talk more about that. You need to examine cultural issues in assessment and diagnosis and understand the practice of using tests in counseling. Some counselors use a lot of tests and some counselors use very few, and some don't use them hardly at all. So you need to understand it. And what kind of counselor do you think you would be? Would you feel comfortable utilizing tests or not? You also need to comprehend the ethical issues pertaining to evidence-based therapy practice. As always, complete the self-inventory. It's important to know what you know and what you don't know. I would definitely look through the case studies that are in the chapter. Put yourself in the role of client. Put yourself in the role of a practitioner or counselor, because through that way you can think, what would I do if I was in that situation, or what would I do if I was that client? Once again, I hope you learn a lot in Learning Plan 10. Contact me if you have questions.